next podcast with Unfiltered Physicians. So Dr. Hester and Dr. Philipose here. And today we just thought we'd just keep it running, right? Just have an open conversation. We'll be having some more guests coming over, but we just thought happy Sunday. Let's just kind of have an open conversation and see what other topics we can just discuss.
Right, let's get it.
I thought maybe we could continue on some of that conversation about, I think our profession, you know, we forget that we're humans and we're not capable of doing it all. And we're one of the few professions, unlike our medical colleagues, where they get a paycheck, but, you know, we're held to a different standard and we've got to be able to deliver quality service. We've got to be able to cure people. We've got to be able to talk everyone off a ledge and then manage employees, manage marketing, and we're cleaning our own place and answering our own phones and texting patients like on a Sunday, what I'm doing here today. And, you know, we all kind of get a little overwhelmed sometimes. But I thought maybe we can just kind of jump into that and maybe talk about some other stuff.
There's a lot to that a lot of people don't realize that we go through because we're our own entity, we're our own corporations or whatnot. Lots of people they have a job, so they show up to work and they're usually getting paid either salary or hourly. But with us, we've got to get in there and we're the corporation, you know, so we don't do well, then there's nothing left. There's nothing to pay out. So I've always told people that, hey, you know, that the corporation that we have, if patients don't come in and we don't get them better, we don't have a practice. And for a chiropractor, it's all word of mouth. You know, we don't have that we have to get patients better so they are compelled to go out and say something good about you. Say, hey, go see Dr. Hester, go see Alvin. They're great. They helped me with this. So it takes a lot. When people go to the hospital or other entities or professions, they don't have to get good or not. They get referrals. They just come in. So we've always told people that no one understands a chiropractor like another chiropractor. The ups and downs that we go through day in and day out.
Yeah. And I think that's where, I mean, we're in a different position, Dr. Hester, where we're in Oklahoma. We can identify a little bit even different. I was talking to Dr. Hickman a couple of days ago about how most of the chiropractors in the world, I mean, we're talking, you know, every country and every other state except Oklahoma. We forget what our scope of practice is and what our capabilities are to redefine what healthcare is. And I can see how a lot of the chiropractors get frustrated and they join these management groups. We all did it, right? You join management groups and you know, you get kind of sucked into this thing where you're like, man, this guy's driving a Ferrari and this guy's driving, you know, living in this $2 million house, $3 million house. I can get there too if I see, you know, 150 people a day, which is fine. I mean, if that's what you type of practice you want to get into, but and you just keep hoping and hoping and hoping and hoping. And next thing you know, 5 years goes by, 7 years goes by, 10 years goes by. And we talked in an earlier episode about how insurance is changing and restructuring. It's not like how, you know, all the medical and dentists and our groups all used to do billing and stuff like that. You have to deliver good service. And even if you did, you're not getting paid on it using traditional insurance the way it used to, which is why you're seeing a lot of medical colleagues start doing manipulation training. I saw Empire Medical is doing manipulations trainings for nurses, medical doctors, and dentists. Well, all of a sudden, we're okay with adjustments, right? We're not scared of strokes like what they've been proclaiming for decades, you know? And so all these different treatments that we do. And I think the identity side of it is we are able to offer a lot more services and treatments than the traditional guys can, which is where we don't have to do a lot of these management groups, right? Like we can see, you know, 20 people, 25 people deliver good service and and get those referrals, and we're not worried about high volume type of practices. But I do refer to chiropractors that are doing that. And so I think that's where we have to kind of take a step back and really appreciate what we have. And I think that's where I'm having trouble kind of explaining things to some of these younger chiropractors like, hey, we're having some serious, communication issues about explaining where we're at.
Yeah, there's a lot of them that don't really have a clue what to expect. Um, I my thing is like going back to the chiropractic adjustment. Like that's the foundation of what we do. Or we're going to adjust patients, and it seems like sometimes we talked the last time with when we were with Michael about how a small percentage of the population go to chiropractors, and it's a constant battle of trying to um, explain yourself and how you can help patients benefit. Um, Most people don't even know why they would get an adjustment. You know, I have so many new patients that come in at age 50, age 60. I'm like, man, I can imagine if that was the first time I was receiving an adjustment. Um, and that's the sad part because, I always say the American Dental Association did a really good job by telling people to floss their teeth and to brush their teeth to prevent cavities. When we're growing up, that's what your parents brush your teeth. Make sure you prevent. You want to prevent cavities, but no one ever told anyone to get adjusted to help their spine and to protect their spine. When we were, I mean, chiropractors were taken to jail back in those days. When for adjusting patients, and it was just simply if people would have just helped the chiropractors out and say, "Hey, chiropractor is good," just like the dentist, get it, get adjusted. That helps your spine. It keeps your spine moving properly, keeps it healthy. If I always call it spinal cavities, you know, when your
Yeah.
it tightens up, it's like that's like not flossing your teeth. Your gums are not healthy, and so I tell patients that to this day. Get adjusted. You don't have to hurt to get adjusted. You want to make sure you're balanced, and most people wait until they have a problem, a crisis, a pain, and then it's like their husband or their wife has gotta beg them to come in. They're already getting care and telling them how much better they're getting, but they gotta pretty much beg them to get in. And that's just what we deal with. That's what I've dealt with in 27 years is such and so said chiropractic doesn't work, or once you go, you always gotta go. The whole premises of that is you once you go, you realize how smart and how effective chiropractic is, so you want to go. I can't imagine going the rest of my life without getting adjustment. I just couldn't.
Right. No,
Most
I
people just
agree.
don't understand that concept.
Yep. Yeah, I mean, my shoulder was hurting and I had Dr. Hickman adjust me, dry needle me, inject my shoulder. Here I am 3 days later, it's already better, right? And I'm going back for another injection. So,
Yeah,
I think uh, guys like us we view our profession and our business and our patients a little bit different than some of these guys that are 5 years in practice and younger. I think we've kind of come to the realization, like most of the guys at our age, is we can't cure the world. I mean, we were so gung ho coming out and we're pumped and ready. We're trying to cure the world. And man, you get talked down to from friends and families and everybody else. And then here's this other group that man, like, man, that doctor's great. You got to go see my guy. I got a call from New York that said, "Hey, I heard, you're one of the best that does this and this." And I was like, "Yeah." And, I'm trying to find her somebody out in that area. But it's kind of cool to get a call from New York. I had another call from Idaho. And I think guys our age kind of learn to appreciate, all right, we're here to treat those that want come before our presence. I'm going to give you the best I've got. And if I can't help you, I'm going to help you find somebody that can help you and prevent you from getting on drugs and surgery. And, we're not here to step outside of our zone. We're not here to go and, start doing all these different things. We just want to stay in our lane and we just want to treat and we want to go home. I'm not trying to sit here and proclaim one thing or another. I literally just want to treat my patients and go home. And I feel like we lose our identity when we start kind of, we just get into this, man, I can see this many people in a day and I made this much money and this and that. It's just so tacky. Like nobody in our group ever talks about money and how much money we make and all this other stuff. We just go and do and live our life and do the same thing what most medical colleagues do is we just we just go and live, right? Like we're not caught up in this little paradigm that our profession is really bad at. And it gets frustrating when you see some of these younger kids kind of falling for that and they don't understand that is not the way to go. I'm telling you, you're going to get burned out. That is not a true concept. And if you want to sell yourself for like what, the joint's done to us where you're doing something for 10, 20, $25. Oh, I can see your friends and family. Oh, by the way, you just have to pay $10 for this guy and this $10 for this guy. You just lose the identity and the value of what you're actually doing.
I opened up an email last night, and it was from the joint trying to hire someone, so full time, part time. That's like, oh my gosh, like this, they're just sending them out to anybody. But no, thank you on that. I'll keep my own practice and do my own thing. Patient management. How's your patient management? Like, how's that working out? I mean, uh, one of the things I wanted to address is I probably every single day I get like 5 calls from patients calling. First thing they'll say is, "Do you accept Sooner Care? Or you accept this?" I'm like, "No, I don't. I don't accept Sooner Care," and because they don't pay anything. And so and then they'll hang up. There's patients calling and see if you accept this insurance, and I go back to whenever you have a toothache or whatnot, do you just call up a random dentist to find out if they accept your insurance? Oh, I mean, I don't. I'll usually ask a friend or close friend that, hey, do you know of any chiropractors that are good? Or most people get on Facebook and ask, who's your chiropractor? And you'll see people listed. Go to my guy. He's this and he's that. And you'll see like 10 different chiropractors listed from the response. And I'm like, man, um, it's just it's hard when patients call and they only want you if you are with their insurance carrier. And that's so big misconception because there's so many people that I'm a provider for Blue Cross Blue Shield, and most people come in acting like Blue Cross Blue Shield like that's going to pay for everything, like they have the best coverage ever. I verify the coverage, and they've got a 4 or 5 thousand dollar deductible that hasn't even been met in 20 visits. I'm like, you have no coverage, but they think they have coverage. So it's just like, man. And then years ago, it wasn't that bad with the high deductibles, but now it's like they're 3,000, 4,000, and most patients don't even understand how the deductibles work. How the deductibles work is if that deductible has not been met, we don't get paid anything. The money that they would pay us goes towards that deductible, gets deducted off. And I tell patients that all the time, and they don't get it. They think they're good to go. And you can't ever meet that deductible if you got 20 visits or 24 visits and a 3,000 or $4,000 deductible.
Right.
And I know you, doc, you don't even do insurance anymore. And I know it's
Yeah.
frustrating for you, and it's at the point like that for me because it's just a misconception. And people stand in front of me look like I'm the villain because they have an insurance policy that they have a high deductible that they didn't know what they were getting into. They think that that's going to pay for everything. I'm like, my goodness.
Yeah, but you have a pretty unique practice. I have a unique practice. And when I made that decision to give up insurance, it was like I felt like these handcuffs are on me, right? Like I I I I I have to do XYZ to jump through these hoops for this, but when my patients come in, I have so many tools in my toolbox. My job, I mean, I had a patient call me today and I just went up to the office. I just got back. It's on a Sunday. I was doing a favor, went in, severe pain. It's got a disc, possible disc herniation. And he's like, I have to go to work tomorrow. We spent 30 minutes, did an injection. We did dry needling. We adjusted and he's better. He just texted me and said, hey, I'm better.
Hmm.
So, I think our problem is we're defined by that concept, old concept of how we're supposed to get paid. I had a consultant, oh, it's about 2018, and I sat in on one of his consultations with his patients. First thing he did was, all right, why should I even accept your case today? Like, you're presenting before me. I understand this is what you're going through. I saw your intake, but explain why I should take your case. And the patient just kind of sat back and is like, well, I've never been asked that question before. It's okay. Well, you've seen the medical doctor, you've seen the physical therapist. Explain to me why you're sitting in front of me and why do you think those two things didn't work and why I should take your case. She's like, well, I'm hurting, this. He said, well, that's not what I asked you. What are you willing to do at home to make sure that you're compliant, that you're going to show up for your business, you're going to do your exercise, you're going to do your diets? And you'd be surprised, patients are never asked those questions, right? They're asking us, they're interviewing us on why they should come in, why we should accept them, but it's not the other way around. And when you turn your mindset to that, you're like, "Look, I'm the best of the best, and may not be perfect, but man, I'm gonna deliver good service." It for you to be in practice after 5 years and for you to be successful, you've gotta be really good at what your job is. We don't take sick days. We barely get vacations, or if we do, we're always worried about the practice. Our staff doesn't understand it to the extent. Our friends don't understand it. You're not gonna get referrals from your friends like you think you are. Even your family doesn't understand what you go through, but I think that's where us as chiropractors have to take a step back, man, especially in Oklahoma. We have such a good opportunity to redefine healthcare in Oklahoma. And I feel like we're dropping the ball because it's the same 10 or 12 people screaming up and down, like, man, you can do, consultations on functional medicine. You can do IV treatments. You can do injections. Hey, I know this chiropractor that's doing joint injections. Maybe I can refer to him and build a relationship. Or, hey, there's a doctor that's doing, high dose vitamin Cs for, cancer support therapies. Dr. Taylor, he's one of our, good friends and colleagues, and he's got a great practice. And how many chiropractors refer to him whenever they can't figure it out and vice versa, right? And if we have this internal network and we have this self-worth that we agree with, instead of following all these guys and drinking the Kool-Aid, we just literally have to have that confidence and be like, "Hey, I got a low overhead practice. I've got great staff that's there to support me. I've got these structured plans that are going through, and it's a one-on-one with the patient." Man, we own this thing.
Oh, yeah, we do. I've 27 years, I never called in sick, never took a sick day, never showed up and like, "I'm sick," and called in, never, not once. I mean, um, we're driven to serve the public, our communities, even when there's snowstorms in Oklahoma and most people, oh, but look for a day that's a day. I mean, gosh, if they say it's gonna snow an inch here, schools are canceled, and I get it. They don't have the tools, the trucks and the salt and whatnot, but I'm from Utah, so I can get through it. If it's not ice, I mean, I can get through it. So I've always showed up to work, and I mean, when I go to work on a snowy day when there's like 1 inch of snow, we're not it's a ghost town in Oklahoma. I'm at my office complex, but the only one there. Everybody in the whole complex didn't show up, but I'm still there. And so that's just my devotion because I know there's people that can still get through it, and there's a handful of people that still come in. They don't look at it like, I'm not gonna get out and come in. But that's just what we're devoted to do and serve the public at all costs, to be there for patients, no matter what. And I'll do that until the day I am out of practice or I'm not here anymore. And that's
Yeah,
just the foundation of
I got a funny story about that. A couple years back, and my wife's watching this, she's gonna get a chuckle out of it, but I did something stupid where I bought a brand new knife. I cook all the time at my house. That's my favorite pet. And I bought a knife and, we're cooking breakfast. I'm making this big brunch. I had people coming over and I reach for a towel, drop the knife on my foot, dash it open. There's blood everywhere. Kids are running around. I'm in my boxers. It's my sister-in-law walks in and wrap my foot. I go to the urgent care. They're like, "Well, you looks like you nicked an artery." I said, "Great." And there's just, I mean, it's just squirting out everywhere. So I end
Mhm.
up at the ER. They shoot lidocaine, stitch me up. I've got like 3 stitches in my foot swollen. Well, I had a full day the next day, and I don't like taking medications like that. I'm very stubborn with medication. Like, you can't talk me into just taking a pain pill because I have reactions like my mom does. I go in, foot swollen, and it was hurting so bad. I broke down. I took a prescription. I ended up vomiting, and I haven't touched it. So the rest of the day, I'm just sitting there working on people, and I'm in a
Yeah,
stool, just scooting back to
yeah.
back to back. And you don't take off work. And when
You don't.
we
I
take
mean,
off work, stupid things, you get so frustrated. I'm look, even if I had 100-degree fever, I'm gonna take a
yeah,
step back. You're gonna do something for them, but I'm gonna show up at work because we do not take those vacations and stuff, right? Like, and we grew up in a different area. I think our guys, 15 years in practice and older are, we're a little bit more bolder, I would say. Like, we would jump in and we just start taking these techniques and flying out, coming right back to work. And but we still sometimes even sacrifice our family and kids just to get our business to thrive. So I'm going to ask you a question. Kids that come out of school now, we had these practice management groups and stuff to kind of teach us some stuff. But if you're a young kid coming out of school and you're wanting to open a practice, well, how would you say you would do that? How much money would you need? What's the best way to go out there? I'm in an old school thinking mode where, you go and, I mean, shake hands, right? Like, it's handing out cards and shaking hands and getting people in. But what would you say to these younger kids that are 5 years and younger? Like, what type of practice they should have? What trainings should they jump into? How would you open up a practice like that now if you had to look back?
me myself, I would definitely start by myself if I had the finances to. I would find a small square footage, 900,000 feet, and I would start like that. Um, there's some people that come out and work for someone because that's what they do, but the hard part for me is, I've been there and done that. I've worked with other practitioners and it never worked out. It never worked out. And so it just turned ugly to where, you know, um, to where I've practiced with several people I don't even talk to this day. And, cause just because the badness that happened in that practice when you got two doctors in the office. And I'll just go ahead and tell you a story. So I was practicing in Utah with a doctor. When I came out of school first, I went and I practiced with the doctor that talked me into going to chiropractic school, Dr. Lulu Wright. So I went back to his practice in Ogden, Utah, and practiced with him. Great, great person. His office all set up. I was just, in the room, and it was a 60-40 deal. You know, I kept 60, he took 40% because his girls were collecting. And that's fair. But, when you come out of school, you can't just sit in the office because there's no patients coming to you. So, if I made $1,000 a month, I got 600, they took 400 of it, and
Sure.
you really can't make it off that. You got to get out and bust your butt and do screenings and try to get your name out there. And after a year, I was like, man, and I'm living at home, I moved back in with my mom, and so and still couldn't make it after a year I mean, just because didn't know. So the one thing I think that, yeah, practice managements are good for that to give you some guidance, but some of these practice management, like, after that, do you need to stay along that management? I don't know. If that works for you and you can afford it, go do it. But once you know what you need to how to run an office, do what you want to do. Um, but when I did that, I had to leave that practice because I wasn't making enough money. So then I said, well, I'm gonna go practice with this other guy. And so I went in with practice with him. We're splitting office space and right down the middle. And so we did that for what, 3 years. And he had the concept of open adjusting. And I wasn't really good with open adjusting, because, his adjusting table was not so far from mine, and his patients were over there, and you're overhearing conversations. There was just no privacy. Um, my patients were just not really cool with it. Hearing conversations about the lake and all this stuff, and that stuff doesn't help people get better when they're on the table and you're talking about, going boating and going wakeboarding and stuff like that. It's about, it just wasn't for me. So I I saw less people. He saw more people, but I was still splitting the rent half down. I co-signed on I was a guarantor on all the equipment for whatever reason, I don't know. So I Dr. Lance Goodwin talked me into going to Pinnacle. I was struggling. I was married. My wife was pregnant. I'm thinking I got to make some money. My wife's pregnant. This is a lot going on. Uh, I got a mortgage, and I said I got to make a change because I wasn't doing as good as I wanted to. Didn't want to go down, continue to do that. So I didn't even have enough money to make it to Tulsa. I didn't. I didn't. And Lance Goodwin, dear friend, he's awesome. He kept saying to me, man, just get on the plane. I'll buy your plane ticket. And I felt bad, and I turned him down once and to go to a Pinnacle meeting. And he said, I get it, but we'll try next time." So next time there was the seminar in Tulsa, and I said, "Dude, I'm coming." He says, "I got your ticket. You better be on that plane." And so I flew to Tulsa, and I think it was 2003. It was in like September, and I get there. And he says, "Are you on the plane?" I said, "Yeah, dude, I'm on the plane." And so I landed in Tulsa and stayed with him. He lived out at Catoosa, him and Molly. Molly's a chiropractor as well. And Lance's office was out in Catoosa, and it kind of blew my mind. Didn't kind of, but it blew my mind because he drove me out to the office in not Catoosa, but Inola. Inola in have you been at Inola, Oklahoma?
I know what
It's
you're talking about.
small. It's small, so I wasn't new to this. I'm from Utah, the city, whatnot. I wasn't used to all that. So he drives me out there, and it was like there was just a gas station, and he was seeing everybody in the whole town basically. I mean, the Amish people were coming to him. I mean, they were pulling up into his office with like with the
Bug.
horses, with the back of the thing looked like a truck thing. You know what I mean? And so I was blown away, and I'm like, dude, this is insane. And so I was so excited. Went to the Pinnacle meeting. And I ended up joining. And I went back to that practice and said, listen, I know we got 2.5 more years left on lease, but if you use any way you can let me out of this lease, I want to get out of here. I said, you can have all the equipment, all the equity in the equipment, the extra, you only have 2 more years to pay for it. You can keep it. We got all the equipment. I was a guarantee. So, okay, yeah, that's fine. That's fine. So we had a verbal agreement. I was a guarantee. So I left and moved and started practicing Layton, Utah. After about one After about 1 month, I didn't have any staff. I jumped up and started seeing like 100 patients by myself with no staff. Didn't have any heater in my office because everything was like slow, the process of building it. And I just started doing really well. And so the other doctor caught wind of it that I was doing well. And long story short, my brother-in-law at the time was friends with this doctor I was practicing with. He told him, Kim's doing really good, da, 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 da. This dude gets all mad and pissed off, and he decides to leave that practice because I'm doing good. So he leaves the practice and leaves me high and dry. He takes all the dang equipment and he moves in with another daughter, takes the equipment. Next thing I know, my wife has had the baby, and I get a call from the bank. It says that you owe $60,000. I'm like, what are you talking about? $60,000? Like, yeah, you owe 60 and you got a 1 month to pay it. I'm like, are you kidding me? And I said, oh my gosh, $60,000. And my brother-in-law at the time knew he was leaving the practice, didn't give me a heads up. And it was just devastating. And I had to set up on some payment arrangements. I paid him off in 3 months, but that was a deal with being practicing with someone. He kept all the equipment. I didn't get any the equity of the equipment. That After that point, I said I'll never practice with anyone again. Never, ever, ever again. It just because it
We
just
we just all have stories after stories about how where we're at, right? And it's
yeah.
I mean, went to my first Pinnacle meeting, and I still am good friends with a lot of guys. And, you know, my practice actually still runs off the original floor plan that was designed for me. And, we just learn to kind of navigate through these little hurdles and get to our practice the way it is. And I think it makes us good business people too. But
Yeah,
I think for someone that's opening practice, we have our skin in the game now is we just want to be left alone, practice for the next 15 years. And then after that, I'm going to see what I want to see. It's not, it's no fluff. You guys can do whatever you want with the profession after I leave. I'm okay with that. You want to go do high volume manipulation. You want to do whatever you guys want to do. You can go ahead and do that. Just let me run
free
my
will,
practice.
man.
Free will. The one advice I'll give to every chiropractor in our state, which I'm known as a hothead and the really, vocal one for our profession. I will say in the last 3 years, I am still the one that is still thinking that if we come to the table and come to some sort of compromise that we can really advance our healthcare in Oklahoma. The one advice I'll give some of my younger guys is, man, go and watch your colleagues, even if you don't agree with it. You do zone at your office, right?
I do. I do that. It works for me. Religiously, I do it. I get great results with it. Yep.
I took some online stuff during COVID. I just wanted to learn it. I think it's
Hmm.
fascinating. Used it. Funny part is there's certain components I'll still use today. I don't do a zone
Yeah,
practice, but
sure.
um, QNRT. I mean, I go and learn from other doctors, and there's still some stuff that I use and don't believe in, but it's okay
Hmm.
to venture out. And the one thing I'll tell my younger guys is don't drink the Kool Aid because these older guys are already made their money. They're gonna sail away, and they were in a different era where they can bill out insurance and waive copays and take $500 for the whole family, and then they get referrals, and you got these high volume. They're not telling you the full story because guys like us figured it out a little bit later, right? Like we figured out what the game
Yeah.
was, but these younger guys aren't seeing it. They're not. Their blinders are right here, and I get the philosophy. Everyone's got their philosophy, which our philosophy is what got us into chiropractic school and got us to open our practices. And instead of
Hmm.
attacking each other, you save up $1,000. I got a guy that opened a practice for $1,000. He got a used table and he ended up getting a acupuncture deal for the auricular therapy.
Hmm.
And he's got a laptop that he had from college. And this guy is killing it. I mean, he's doing so well in practice. Same model. He's got
Yeah.
now an AI receptionist that answers all his calls. He's got an online portal that patients can schedule on their own. He refuses
Right.
to hire anybody, and they do so good. You can
Yeah.
now with AI, you can open up a practice for absolutely nothing. And if you
Right.
go
Yeah.
to an office space, you're like, look, you give me 60 days where I'm not having to pay rent. Let me just get set up. You can tack that on at the back end, and you're paying $500 a month, or go to another chiropractor and see if maybe he has a room. You don't even have to be paid by him. Just say, hey, can I rent a room from you for $250? And you can go and hand out cards and you just introduce your people. There are so many sick people and hurting people out there that you can build a phenomenal practice, and you don't have to overcomplicate it and go take out these $50,000 loans. And you don't have to have an X-ray on site. You can refer out to one of your buddies. My C-arm broke, and I referred to one of our colleagues. He shoots the X-rays. He'll send them right back to me, and they pay cash, and they're right back. And I don't have right. Like you can do this if you structure right, but instead of paying a management, go to your local guys. And even that's why I think associations are important. I'm not trying to differentiate between any association. I don't care what association you're in. Go to an association and find a guy that's practicing the way you want to practice. Take him out to lunch. maybe offer to pay him like we did. Like I remember paying a guy up in Arizona, I think it was like $1,500. I didn't have 1,500 bucks.
Right.
I borrowed money and I flew down there. I took the course and I lined up all my seminars and stuff that I needed after that to get patients through the door, and boom, it just took off. Right. I mean, we pay for each other's times, and that's okay to take someone out to the ranch or a steakhouse for some advice, because I promise you, you will learn more from guys that have been through it than you will from anyone on stage. And you got to go and get education. And I'm a big on that. Go get educated. Not our state board education stuff that I'm talking about. You fly out to these seminars, and whether it's a chiropractor, naturopath, or medical doctor, if you see something that's in your scope and you find out you can go do it, man, go learn it and implement it. I promise you, that is how you build a practice. You won't have to do anything else, but just keep up with the calls and just see what you need to see. And 6 o'clock, leave it at home, go spend time with your family, then schedule your vacations. And it's okay to take a 4-day vacation at that stage, because you'll be busier than you can imagine with just a low overhead. But would you say like that's a probably a good strategy, or is there something else you think that they can add to it?
No, that's a good strategy. You just is start off with the cheap as you can. You know what I'm saying? But you can do it. You can do it. And um, I would also ask these kids to start asking questions before they get out of school, because I know you're in school and you're taking all these tests, and I mean it's hard because you got 33 credit hours. People don't realize what chiropractors go through. Like that's another thing. They don't realize that the degree of chiropractic, to be a doctor of chiropractic, is so it's like a medical doctor, like a dental degree. That's the same type of criteria. But we've got now these kids in their school 20, 30 credit hours per
Yep.
trimester or whatnot. And
Yep.
you don't really have time to really do a whole lot of thinking on practice stuff because you're trying to pass tests all the time. But what I understand now is that you can start, you can take boards now immediately. Like after you pass part one, you can take all the rest. You can
Wow.
take two, three, and four, or whenever you want to. And when we were in school, you can only take one and two at a certain time. You can
Yep.
only take three, four.
Yep.
Now, part four, I'm hearing that part four is like many times a year, but you have to go to Greeley, Colorado to do it. You can't just do it on a
Wow.
local campus. So you have to go to Greeley to do it. But there's multiple times. Like, I think you can go monthly if you want to. But the test is like $2,000, I think. So you got to know your stuff. And the thing about it too is, think about this: if you don't take, I think board reviews, you got to take a board review. And if you don't take a board review, good, you may not pace those tests, because you got to learn how to take the test. And so if you have to take a board review to pass the boards, why wouldn't you not do something and learn from a doctor like outside that's practicing, that knows what's going on, for practice as well, just like the board review. You need to have a review for how to practice too once you get out of school. But starting small, 800 square feet, I would do that all day, and then just build up, just get a small office, rent a room out just somewhere, and do it that way.
Yeah.
But
And that
definitely, I probably wouldn't go work at a place, because you get stuck in that. I mean, if you're going to make like, if these places paying someone $90,000, you're working your butt off like 6 days a week, and they can fire you at any time they want to, and you got to restart all over anyway. But then what mindset do you have as starting to practice if you're doing $29 adjustments for entity? You know
right.
what I'm saying?
And that and
Your mindset is $29. Oh, you don't know nothing different than that. So I don't know, man. I wouldn't do it. But
yeah,
money talks and bullshit walks, right?
I'm like, nope. I mean, I remember I had, I've had multiple associates. It just never works out, and,
Tough.
um,
It's like a
nobody.
marriage, man. It's like you're married to these employees. That's what it is. And if something goes sideways, it's just bad. You don't even want to show up to work. That's just like having an employee work for you. And you got to let them go. You keep on
Yep.
holding on to them. I told
Yep.
all my assistants, like, if I walk in here one day and I don't want to see you, and I got that mindset, just because the stuff that's going on that you're not doing and you're manipulating the situation, then I've got to let you go because I can't have that on me, that energy. Where every time I
Yeah.
look up the front counter, I know like, damn, what's she doing? She doing this? Like, is she on her cell phone? Or I mean, I had CAs that were behind my back on Instagram doing posts, and they know I follow them. So I'm saying, "Look, if you did that post at work, you were supposed to be working for me. What are you
Yeah.
doing?" You know what I mean? So I'm like, post something
No.
about chiropractic. No, they're posting pictures and stuff like that.
Yeah.
So people are just addicted with this social media stuff too, man. It's
Yeah.
crazy.
I
It's
mean,
crazy.
everybody, look, you can use social media to your advantage. And, we just had a lady come in from Florida and she's, all of her clips are viral and she's really got a great practice in Florida. She's busy. And she was talking to me about social media and stuff. You can take it to your advantage, but man, I just went through this. I just let 3 employees go all in 1 week. And, I would leave and patients would show up and no one's there. They would leave early, and we pay. We're paying these salaries, and
Right?
another guy comes in, and this isn't organized. That's not organized. We have a girl that helps us with our IVs, and she didn't believe in what we were doing, but she wanted the salary, and she was like, "Well, why are you doing that?" And I was like, "Well, this is the science behind it, this and this," and I asked her to go get me something, and she's like, "No." And,
What?
the
What?
recording
She said no,
what? So
man.
I went to a seminar, and I'm pretty patient with my employees. Like, I'll train you, and I jump in. I'm cleaning and doing stuff all the time too. And when it's your business, that's what you do, right? And as a Friday, I'm at the seminar. I go in. I just needed a break because I was having a mental breakdown over 2 weeks. And I sat down, got a mimosa, and I was like, you know what? Why is my energy so bad? I walk in, well, my energy's bad. That's going on to my patients. And we
Yeah.
all know how it works. I fired off a group of text messages and let everybody go overnight. So I said, I'll
I
figure it
mean,
out Monday.
sometimes
You did.
yeah, yeah, sometimes you gotta do that, man. I mean, because it's
Yeah.
like a weight off your shoulders and the negativity is just not there, it's
The
just
funny
but
part
yeah.
is they was busy. Walked
Mhm.
in just busy. I mean, it
Yeah,
was awesome. And we
yeah.
all go through that, right? But you can only identify with another chiropractor that has gone through that. And these young guys have to find the older guys and be able to identify and have these conversations, be like, man, I got this employee issue. What do you think? And they'll be able to walk you
Mhm.
through, hey, how you do it properly. Um, I don't know. There's a lot of things I think you would probably agree with if we had to start all over that we would do. And I think you can't avoid mistakes, but the mistakes make you who you are today. But if I had to turn back the clock, there are certain things I would definitely set in place, right? Make you even more successful than what you are today.
Yeah, I mean, I just blinded, I didn't know. I mean, I didn't know what was going on when I got out of school, I just didn't. We had a class, the practice management class that was a joke in school, like
Yeah.
1
Right.
semester or whatnot, and it's like it didn't tell us anything on how to do anything right. Um But the banks don't wanna loan chiropractors money when they get out of school, that they didn't back in the early 2000s, they just didn't. It was hard to get a loan. You had to have a significant business plan and showing a lot that you're able to make that kind of money and whatnot. So that there pushes people to just do it on their own as well because it's hard to get a loan and definitely probably hard to get a loan now with how the
Yeah.
stuff is
Let's do it.
now. I mean, how you gonna go to a bank, get a loan when stuff is like it is now? I don't know. I mean, bank
If
don't
not
trust nobody. Like,
loan chiropractor, it's not going to happen. I don't care.
yeah,
You're not $50,000 loan, and why would you want 50 grand in debt on top of your student loans? And we just all like. I don't care what anyone says. Do not believe what everyone. I mean, do not look at what someone else has
no, don't do
because
that.
God is on a path that is a
Yeah,
different. And do not believe these guys. It is not that easy. You have to put in the work. If I had $750, right, or $500 a month, I'm gonna take 100 of that. I'm gonna take my wife out to dinner. I'm gonna take 400 of that. You will be better off taking $400 in donuts and coffees and maybe nutrient bars or however you want, fruit baskets, going to local attorneys in your area, reaching out to PTs, reaching out to orthopedic surgeons and pain management doctors. And look, you're going to get turned down probably 90% of the time, but that 10% we just met a therapist that is referring a lot of cases now, a psychologist. Who would have thought? And that you will create a bigger practice doing that than paying somebody $500, $750 a month for him to just sit there and spout these numbers off at you and fake texts and all this other stuff. You will learn more off your colleagues and doing stuff like what I just described than anything else you can do. And I promise you, in 90 days, you'll have a different discussion. You get your wife. My buddy and I got him a case of beer and I said, man, I got these road signs. I need to put them down on a Friday and take them up on a Sunday. And we hopped up in the back of his pickup and we were putting signs down at 20 different intersections and picking it right back up on a Sunday. And we would show
Yeah.
up at health fairs. And health fairs, I had a whiteboard that said, ask the doc. And that's it. No
Mhm.
gimmicks, no spinal, stuff or what are those little myovisions and all that other stuff. All I do is ask the doc. And I sat.
Yeah.
And I had people coming to this day, 25 years later. I still have my original patients still coming in asking me for advice and questions and stuff. That's how you
Yeah.
build a practice that you will never regret. It's fun.
Exactly. I had, this week I had this patient come in and he came in like early in the morning. And so he comes in and I said, he fills out the paperwork and whatnot. So he fills it out. And he's got Blue Cross Blue Shield. So I verified it off of Availity real quick. And he's got like a $4,000 deductible. And I said, basically, you don't have any care, any treatment that I can do anything with. And then so he then makes the stance to say that, well, I saw this thing online, and when I scheduled on your scheduler, it showed me that the consultation was at no charge, and then also was included the exam, X-rays, and no charge and adjustment. I said, "Are you serious?" I said, "Man, show me what you saw." And so he fills up some thing that's not even my website. I said, "Do you see this right here? This is my website right here. You know, you see the skyline of Oklahoma City." I said, "I don't know what one you clicked on or what happened there, but I said, "This isn't free. It's not free, man, you know? Like, you can't accept it because your neck hurts to click on something or to come into a doctor's office and get a free exam, free X-rays, and free treatment, not to pay anything out of pocket. Like, that's not gonna work."
Take it.
I said, "This is not free chiropractic. This is not." I said, "This is not welfare chiropractic here." You know what I'm saying? I said that to him. And he's has like an attitude, and I'm like, "Well, listen, I just tell you, man, that you probably should go somewhere else because the mindset is not clicking, and I can't accept you as a patient with you having the mindset of thinking that you're going to get something for free. And even if you say you want to pay now, we said, "Oh, I'll pay now." I'm like, no, it just doesn't work because there's no rapport, there's no agreement. I could adjust him, and it's gonna be he's gonna think it's a shitty adjustment because he thought it was free coming in, and it wasn't free. And so now it's like, now the adjustment didn't work. On top of that, he was from out of town, didn't hear him business. I said, "No, I go somewhere else. I'm not accepting you the patient."
Yeah, I
But
mean, we
some
get
people
patients.
just have the mindset.
Yeah, it's a mindset. And I turn people away all the time. I mean, we had a case. Well, I'll give you two cases. One guy did a blood test, and he was really rude, and um, he actually scheduled an IV with us, and then just said, "Well, I don't even know why I'm doing this IV." This and that's okay. Well, I'm going to cancel you. Well, I never paid him any attention. Well, he calls back 3 months later. Well, I never had anyone go over my blood test. And she was like, "Well, here's your blood test. I'm going to email you. You said you didn't want to do treatment, so the doctor just released you." And he said, "Well, what am I supposed to do with this?" Is take it back to your primary care, and you'll either get on Lipitor or cholesterol medication, whatever you want to get on. Like that's up to you,
Mhm.
or you can do a natural, but that was your choice. So we wish you the best of luck. Hung up the phone. 2 days later, he calls back, "Hey, I really need that conversation with him because that medication, I've already been on it. It's not working. So I need to know what I can do." And so he's coming in for a consultation. It's on my standards. Then we had another lady, daughter got really sick. They can't figure it out. I ran some extra blood work, found out what the problem was. And she was like, "Well, so insurance isn't covering this, right?" And I said, "Look, have you exhausted your insurance options? Because you're more than welcome to go do that." And she's like, "Well, I'm still not understanding the diagnosis." I said, "Well, I explained the diagnosis." She said, "Well, my medical doctor doesn't agree with that." And I said, "Well, then that means you need to use your insurance, go back to your medical doctor and figure it out." She said, "Well, the Prozac is working." I said, "Okay,
Okay.
if you think it's a Prozac deficiency and that's what you need to do, then my suggestion is you stay on Prozac." My patients
Right.
don't want to do Prozac. They understand
Right.
that I was okay today, and then a week later I was not okay. I need to find out what was wrong with me. I just did blood work. Here's your
Hmm.
answers right in front of you, but you're
Right.
still going back to, well, my medical doctor needs to agree. I referred her back. And so, it's okay to turn away a patient if you don't think it's a good fit, if they don't respect you as a physician, if, well, my medical doctor said this, my medical doctor said that. Well, if your medical doctor was so great, you wouldn't be sitting in front of my office right now. So,
Right.
you know, we
That is
hold
true.
ourselves
And I
to our own standards, right? If you want a
yeah.
$10 adjustment, man, you can go down the guy down the street. He'll do that for you all day.
Yeah.
I got you with the joint. I refer people to the joint all the time. I have no problem with that. If you want a great $10 adjustment, here you go. No X-rays. Run it. But my people know that if you come in, you're going to be held to a different standard. And that's also where I think the young guys, when they come into your office, it is all about the one thing I loved about Pinnacle is your staff stands, they're dressed, they're
Yeah.
positive,
Polished.
they look
They're
in the
polished.
eye and polish, yeah. And man, I mean, that's like a med spa, right? You can go to a different
Yep.
med spas, other ones that are successful. When you walk in, your place smells great, the furniture is brand new, the floors are great. People aren't just kind of running ragged. Even the doctor's dressed up. I don't care if it's scrubs or a polo shirt or a suit. We did a suits for the longest time, and
Hmm.
it's how your clinic presents, how you present is going to reflect on how successful your practice is. I don't go to. I'm an old school church guy where I got yelled at for wearing a polo shirt one day, and I think that's where church has lost its value. I think people get dressed up when you go to church, when you go to meet someone. If you're going to meet, if you're going to meet God, how would you dress? Would you shower and clean yourself and go? So I think the practice is the same way because we use our God given abilities and the innate ability to heal our patients. And if we don't dress and act accordingly, then it will not reflect to that patient. And we can't afford to be down. We don't adjust anybody or inject anybody in shorts, right? Like you're dressed
Hmm.
and clean. And I can wear a t-shirt and jeans and a nice pair of boots and a sport jacket and I can still conversate with a patient, but it is how you talk and present yourself. And do not let a medical doctor or a PT or anyone else talk down to you. You create that standard, man. You will. I go back to you just have such a great practice that you won't ever have to worry about the politics or anything else when anyone else is talking.
Yeah. You have to take care of yourself, take care of the practice. Steve Hayes used to always say that the practice is your golden goose. It's the golden goose. So you gotta love it, take care of it, nourish it, and it takes care of you. And when you stop taking doing those things, nourishing it and taking care of it, and it stops taking care of you. I mean, there's times where I walked in my office picking up lint off my carpet. You know what I'm saying? Because that's just how I was taught. You know what I'm saying? Like I'm making sure the garbage are taken, checking the
Yep.
bathroom every like when someone
Yep.
goes back there, being aware, going back there, making sure the bathroom's presentable to someone else is going to go in there. Just things like that. Spraying him, wiping the tables down, wiping the front counter down. So when
Yep.
people walk in your office like, wow, this smells good and it looks good, that's the first impression. Sometimes your first impression is the only impression you get. These people are scared. People have told them don't go to a chiropractor, all the nonsense stories and that, or they, for whatever reason, they didn't go to a chiropractor because they didn't like the popping noise or whatever it is. Uh, but once they walk in there, they have to feel like, wow, okay, this from just walking in here, it calm me down, and the atmosphere, the staff, the doctor smiling, talking to you in the right, the right demeanor.
Right.
The
Right.
staff showing you, come here, have a seat here, teaching you
Right.
where to go, so you don't feel
Right.
like out of place. So all those are really, really important. I still do this to my day. When a patient refers a patient to me, I write a personal note to that patient that referred to him. That's important. People don't do that no more. It's not like a canned message. It's a personal message that I write with a red flare pen. Thank you, such and so, for referring Joan or whatever it is. We appreciate you. Hope all is well. And I put in the mail, because it's important to me that person thought to refer that person in. And
Absolutely.
so, yeah, yeah.
Yeah.
Um,
We, yeah.
there's one thing I
And
want
that,
to. Go ahead.
well, no, that's what differentiates from even the medical guys, right? We have that empathy with our patients to be able to identify that.
Yeah, the ability to identify. So I had a, a weird. Well, I wouldn't say weird, but I had like a situation where um, th- this week was time for me to look over my personal injury. People who are pending cases, they've been released from care, and to make that call to the attorneys to see like what's up with the case. And so this is an interesting case because I had a lady that came in from Atlanta, Georgia, and she came in town to work. Her mom was sick, and she was, there for her mom. And but she was in a car accident, so she was seeking treatment from someone in Oklahoma City while she was tending to her mom. So I treated her, finished the treatment, um, sent the bill out, um, filed the first primary lien, initial lien, then the final lien, sent it on to the insurance company. And this was last summer, summer 25. In October, I got an email from the attorney out of Atlanta linking the patient to the email, asking me to take a 55% reduction in my bill. And so I messaged back and I said, no, I'm not taking a 55% reduction on this case. That's ridiculous. And so my position was that this attorney would link the patient to the email, knowing that I'm going to respond back to it and decline that offer. I tried to call the patient, I mean, not the patient, but the attorney, follow up every month, November, December, January, February, March, with no response back from the attorney. And so this time, I was like, okay, when you have a PI case, you have to respond. Well, they want you to respond to the attorney if they have an attorney on the case. So I said, you know what? This is taking too long. It's been 6 months. The attorney's not even calling me back because I declined that offer, the reduction. It's like $3,500. They want to take a cut off of. Like you could no. And so
No.
I called the adjuster, and I talked to the adjuster last week. You talk about pissed. The adjuster said that, oh, and he looked the case up and he goes, wow, he goes, this case was settled January 5th of 2026. Isn't that crazy? Case
That's
was
a bug.
settled.
Yeah.
They didn't pay me, and I have my lien. And so I'm like, are you serious? And so I immediately called the attorney. I said, listen, you guys better get me my bleep, bleep, bleep money this week, or there's going to be some trouble. And
Yeah.
so I called my attorney, really good attorney out in Newcastle. And he immediately sent that attorney, that law firm, a email. And within like 2 hours, they're like, what's his W-9 form so we can pay him? We have payment here for him. I'm like, are you serious? They wouldn't even return a phone call to me. So
Right.
the thing is with doctors that are out there that are in Oklahoma and doing PI work, you got to stay on these liens. You got to stay on them. And just because you have an attorney, I would also consult and follow up with the insurance company as well, not just with the attorney, because some of these attorneys just are kind of dirty. I mean, it doesn't take 3 months to
Yeah.
pay me my money. I mean, and to be
Yeah.
upset because I'm not going to take a $3,500 cut, and then to not return my phone call, and then it take another turn to draw up a letter and send to him, and a threatening letter, and then they start asking for W-9s and sending indications that the check is on its way, tracking numbers. You know what I mean? I told him, I said, "You're gonna lose. I said, you're gonna be in some serious trouble if I don't have my money this week."
I mean, that, but that takes experience to go through. I mean,
Yeah.
I had a good friend from grade school, and he pops in every once in a while, and we'll do some stuff. And he comes in after an auto accident, him and his wife, and we did the initial exam, and he actually needed an MRI and a couple other things. I was arranging all the imaging, and we're having to come back. Get a phone call the next day, and a big law firm out here said, "Hey, you don't need to go to that guy. I'm going to send you to someone more qualified." And so they told the patient not to come back. So the patient calls back and he misses the appointment. We call him and I was like, "Hey, where you at?" And he goes, "Oh, well, I was told not to come to you and to go somewhere else." I said, "You know what? Cool. I don't have a problem with that." And we refer him out. About 4 months later, I get a phone call. "Hey, I need to make an appointment. The PT didn't work and they're trying to send me to pain management and I need to come see you." And I was like, "Absolutely not."
I hear that
He said,
about twice a week. I hear that about twice a week. Sorry to interrupt you, but twice a week.
I'm not doing that. I mean, I need you to go back and tell your attorney that if he's got more qualified doctors that can treat your condition, I guess he's got a Rolodex of guys, go do that. Because then what happens is I've got to go in, find out why the other stuff didn't work. I do all this work, I fix you, and then he's going to ask me for a 50% reduction. And I'm not doing that, and he's like, "Well, what do I do?" I don't know what to tell you. You made the decision. I would go back to your attorney and tell him that I said that he needs to send you to a specialist. On the phone. Like, I mean, it's that simple. I mean, but that's where mindset wise our colleagues have to get to is own your profession. Do not drink the Kool-Aid of, well, these guys, I mean, our association has, I can say the rebrand that we did over 2 years, we're going to have a seminar here in a couple of weeks. I think the rebrand that we did was our umbrella is big enough for every type of chiropractic physician and philosophy to come under one umbrella and move the profession forward. And, I've got guys that are like, "Well, you guys are trying to go to advanced scope and get prescription rights and things like that." I said, "I promise you, not one, even if we have internal debates about it, there is no chance that we're going for something like that. If they want to go for advanced scope right now, you go get your PA license. I don't have a problem with that. But our scope is already expanded. We are defined and we will hold our scope. So we protect every single one of our members, regardless. I mean, imagine if I took away activators. Imagine if I took away a tool and we're 50th in the country with health outcome. Imagine I took a tool that's going to make people even sicker. And do not drink this Kool-Aid and let people divide our profession because we're already on the brink of extinction if we don't hold our ground and prevent these other professions from taking us over. That is why people don't know, but our association has now teamed up with an independent medical association. So that way, when we're at the Capitol, we are at the seat having these conversations and be like, we're right here. We want to talk science. We want to talk education. We want to talk about us having a seat at the table when you're discussing healthcare instead of vice versa and isolating yourself. So joining that, our association now has 4,200 members that we can reach out to and really kind of get ourselves defined. And these doctors are amazed. They're like, "Oh, I didn't realize you guys were doing this." We have a university teaching some guys right now. We're in this course right now and in this diplomate program. And they don't realize that, man, I didn't know you can do ultrasound guided IVs and ultrasound guided injections and sugar points and all this other stuff that medical doctors are vying to learn right now, but they can't concept the idea of physiology, whereas we get that better than everybody. So my message to all of our chiropractors in the state is You guys have got to drop your swords, especially my younger guys. Do not drink this Kool-Aid. You guys should meet with people that you don't agree with and come to terms and be like, okay, where's workers' comp reform? We got an auto accident bill floating right now nobody knows about. You will lose auto accidents. You will lose sports physicals. You will lose your status as a physician and end up like Texas. Remember, Dr. Buffington said you can't identify
Yep,
as a doctor. Are you kidding me right now? You can't
yeah,
identify as a doctor. Like I paid 200 grand in tuition and I can identify as a doctor. What the hell are we doing here? You know, why are we fighting like this? These kids have an opportunity to build not only just a practice, but build a camaraderie. When we all get together, do we have fun? I mean, we'll
we have a
rag on
blast.
each. We're talking business one second, we're clowning each other the next second, and we don't all agree religiously. We don't all agree politically. We don't even have the same type of practices. But man, we've got a pretty strong uh, um, group to where we can feed off each other and learn off each other more than
You
anything
know
I've
what?
ever seen in a couple of years.
A- Absolutely. You know what the most gratifying thing is by being having the ability to do the injectables is that I have patients that always come in and they'll say, I had a steroid injection um, a month ago. It lasted for like a week and it pains right back. That's what they'll say. So what I believe is that if I have this ability to do these natural trigger point injections or, the ozone injections or to help people or the joint injections where, I mean, every time I do a shoulder or a knee, they immediately don't have pain anymore.
Right.
And then last year I had that kid that was football player that his the mother called me from Texas. He plays here in Oklahoma, big 302 lineman. He comes in, he can even get in a 3-point stance because of his knee pain. I did the knee injection, the ozone and the minerals, and with 30 minutes after that, he had no pain. And I asked him, I said, "Can you just show me if you can get in a 3-point stance?" He got in the 3-point stance, no pain.
Okay.
And
Yep.
then I only had to do that one injection. I recommended, anywhere from 4 to 6, possibility, but I did one and he played the whole season without any knee pain. But
Sure.
no one even knows about this stuff because they're so caught up on different procedures and whatnot. And, you know, the ozone and injections with the minerals, they work. They work shoulder, same thing, you know. But a knee, I had a lady, 60 years old, came in 2 years ago. She 2.5 years ago for a knee. She came in for 3 knee injections with the ozone. And she came in 2 weeks ago. She says, my knee's been good ever since you did those 3 injections. I haven't had any problem. You know what I'm saying? But we
Right.
don't we don't hear this. We don't people don't hear these stories. They just, they think that, oh, they're trying to I would rather do those natural injections versus my patients going and do injections that are not helping them all
Well,
day. If I have
I
that
had,
ability.
I had one of our colleagues call and they're like, well, there's 35 of us that are doing this regenerative diplomat program. And, if you're doing prolotherapy and trigger points and all this other stuff, and, he made the comment, well, why should the rest of us cater towards the 35 of you? Well, that's not, that's a pretty weird point to make in our profession. I mean, if I'm doing a high volume practice and I see someone knee pain, you don't have the time to assess that knee and deliver something to get that knee better if after 4 or 5 visits. Why would you not refer to one of your colleagues and have him stay in touch with you on that patient? Because if it's genuinely about the patient, then no one would ever make a comment like that, right? Like,
The whole
uh,
problem is they're scared of losing the patient. They're scared of losing the patient, that's what it is. They
right,
don't refer to
right.
other people because 'cause they're scared of losing the patient. It's sickening and sad, you know?
Yeah, it is. It is. So, I mean, I think having these type of conversations, I mean, we have these conversations every time all of us get together. Um, I would say I'm not, if you guys ever see me out there and you want to come have a conversation, be like, hey, I'm confused. I was told you guys are trying to advance scope and practice. I didn't understand what were you talking about. You really want a clarification on it. come stop one of us and we'll explain it to you. And now we're starting to see a lot of these younger guys be like, hey, I really don't want to do IVs and I really don't want to do joint injections, but can you teach me how to do just a B12 or vitamin shot? Or, hey, I really don't want to do trigger point injections, but I really want to practice where, I've got some people that are just sick and I feel like I can help them with an IV treatment. Come learn, or don't do any of it. Come just see what it is. So that way, which guys you want to refer to. And joining an association is a very inexpensive approach compared to paying $700 a month to see somebody else drive a nice car when you can use that money and build a great practice and buy yourself one, right? So
Yeah,
uh,
yeah, yeah.
that's just my philosophy on things, but you can do whatever you want. But I mean, I just really think our younger guys, regardless of what association or how you identify in your practice, reach out to people you don't agree with or people that it's not your game or style of game in your practice, and reach out to them and just kind of take them out to lunch. Be like, hey, maybe I have a misunderstanding about what you guys do in your office, and maybe I can learn something from you. And let's talk about your practice and see how you may have employees or maybe an efficiency thing. Maybe you can learn off each other. Go take someone that used to be in Pinnacle. Maybe you're in a breakthrough practice. Go have lunch with the Pinnacle guy and see what he says. And Pinnacle guy, hey, maybe go learn from breakthrough that you may pick up some patients off of that or learn something from that angle. So I mean, that's just my take before we wrap up.
I like doing what I do. I do zone chiropractic. That's the foundation of what I do, and all my patients know I'm gonna say, "Tell me which points hurts the most, 1, 2, 3, 4, 5, 6," and I balance them and do what I do. But I also love doing the injections. I like doing B12. I have patients come in, they want a methylcobalamin injection. They want Triimmune. We'll have to say that for another conversation of IV therapy, but IVs are really important for people, and most people don't even know why they get an IV. You do many IVs. I mean, I think there's 13 I have. There's one called Alleviate to alleviate stress. Be Lean to help a person get lean. One called Brainstorm that helps with your cognitive function and thought process. Get Up and Go that helps you burn fat more, restores energy. Immunity, when a person gets sick, they would do something with immunity, help build your white blood cells. There's one called Inner Beauty, helps reduce wrinkles and rejuvenate skin. Anti-aging. I have a diplomate in American Board of Anti-Aging Health Practitioners, so I like all this stuff. I like skin products. I like that. It's just things I like to do. There's a cocktail that you can do. There's NAD plus that helps support the brain function. There's one called Quench for ascorbic acid, rehydrates the body. One called Reboot. The name was changed. It used to be the Hangover IV, but that was the one that helps replenish the minerals. Recovery and Performance, one called Snow Bright, to help with skin conditions, one called Timeless to help with skin conditions. There's so many IVs that are beneficial for patients. And so if that's something you want to do, which me and you do it, I mean, so what? Do it. I mean, many patients come in, they want an IV. They don't have to go many other places to get them. They can get into my office if they want to. So I like it.
Yeah, it's the same type of argument everyone has about religion, right? I don't care how you practice. Like, I don't care
Yeah.
who you worship. As long as you're a good, decent human being and you're doing what you're supposed to heal the public, that's all we worry about. So,
Yeah.
I think we're gonna have some pretty cool lineups coming up. We're discussing some of these people that we want to interview and educate them on what's going on here in Oklahoma. One of them is I've got a medical doctor coming on board. We're just going to have a really open conversation about, what's their stigmas about us, our stigmas about them, and really kind of have an open debate. And he came up with a pretty good idea. At our next seminar, we have two orthopedic surgeons that may be showing up and talking with us as well. And we're linking doctors with orthopedic doctors and pain management doctors to create a referral network. So we're doing these little presentations and things like that. We've got some legislators that are coming on board. And same thing, talking about, what do you guys know, how a bill works, why you should get involved with your association, especially when it comes to insurance issues or personal injury issues, and just holding on to what you have so you don't lose it. So I think over the next couple of weeks we'll have some pretty good people coming on board. And um, if you have anything else you want to add before we wrap up.
No, man, I think that's it. We covered a lot, so I think we got a lot out there and feel comfortable with it. I would tell everybody on here that's listening to subscribe. Click the subscribe button. That would be greatly appreciated. We'd love the subscription, Spotify and YouTube.
Yeah,
Other than that, that's all I have for today. Until next
I think
time.
it's even if one of our colleagues wants to come on board, I'd love it. So, but we'll see you guys next time.